Think about the exact moment a medical appointment or a hospital stay comes to an end. The clinical care is complete, the discharge is approved, and the patient is ready to leave. Yet, a hidden friction point often traps them right at the facility doors. They cannot safely get back to their own living room. When logistics fail at this stage, the consequences cascade through the healthcare system. Critical follow-up appointments are missed. Hospital beds remain occupied long after a patient is cleared for discharge. Family caregivers exhaust themselves trying to safely maneuver a loved one without the proper equipment. This timeline illustrates where the process frequently breaks down. Without a specific plan for medical transportation, a patient's journey stalls right at the finish line. This creates a serious question of accountability. Who takes responsibility when a vulnerable patient is left waiting in a lobby for a ride that isn't ready, or worse, one that never arrives? Missed treatments and stranded patients are not simple scheduling errors. When a patient cannot reach care or return home safely, they have lost access to the healthcare system itself. There is a specific systemic solution designed to bridge this gap for individuals with mobility limitations. It is called non-emergency medical transportation, or NEMT. Looking at this comparison matrix, you can see exactly where NEMT operates. It sits directly between standard consumer rideshares, which offer no specialized medical or mobility support, and emergency ambulances, which provide acute clinical care. NEMT is built specifically for stable passengers who require assistance to travel safely. Navigating these operational zones is a critical yet frequently overlooked part of medical coordination. Many facilities and families struggle to secure the right vehicle simply because these distinctions aren't clearly defined. Welcome to SwiftAid Transport. We are a developing, pre-launch NEMT provider preparing to serve Middletown and the surrounding Hudson Valley communities in New York. Before our vehicles even hit the road, we are building an educational platform to help solve these coordination challenges. We operate on a foundational philosophy. Transportation is an inseparable part of the healthcare journey. This channel exists as a unified educational resource for the three groups most directly impacted by the transportation vacuum: healthcare facilities, patients, and caregivers. Let's start with the healthcare professionals, the discharge planners, nurses, and social workers tasked with moving patients safely out the door. When transportation is treated as an afterthought, facilities experience severe operational gridlock. Relying on unpredictable will-call rides creates long patient wait times and backs up the entire facility's workflow. We will use this channel to teach best practices for hospital discharge transportation. We'll cover exact scheduling procedures, communication protocols, and how to ensure a patient is truly ride-ready before the vehicle arrives. Coordinating proactively with accountable transportation partners allows facilities to clear bed bottlenecks and improve their overall efficiency. Next, we focus on the patient. Traveling with physical or medical limitations carries an inherent vulnerability. When ordinary vehicles no longer meet their needs, patients are frequently left confused about how they will reach their doctors. This diagram breaks down the three primary tiers of NEMT: ambulatory, wheelchair, and stretcher transport. We will explore exactly what each level of mobility support entails. Knowing exactly what to expect from their driver and vehicle allows a patient to travel between home and care with their safety and dignity intact. Finally, we address the invisible workforce, the families and caregivers who bear the physical and emotional weight of coordinating these rights. Caregivers inevitably face a difficult threshold the day they realize their personal car is no longer a safe option for transporting the person they love. For you, this channel will offer a practical curriculum. We will show you how to evaluate professional NEMT drivers, how to use technology for ride transparency, and how to clearly communicate your loved one's specific mobility needs to dispatchers. Clear, actionable information protects the patient's safety while helping preserve the family's well-being. SwiftAid Transport is being built around a simple belief. In medical transportation, people must always take precedence over profit. Every ride and every video we produce is anchored by these principles: safety, dignity, communication, accountability, compassion, and transparency. This sequence illustrates our central focus. The patient's journey starts at home, moves to the facility, and must safely return home. That final connection is why we say the ride home matters. If you are a healthcare professional, a patient, or a caregiver, subscribe to SwiftAid Transport. Join us for practical NEMT education and behind-the-scenes insights as we build a patient-centered transportation company from the ground up. Please like and share this video. By passing this knowledge along, you might provide the exact piece of information someone needs to secure a safer ride home.